Joy Sirota, Applied Yoga Integration. We're just looking at a way to assess if we have some sort of pelvic shift. If one pelvic head is forward and one's back, if there's a little bit of a twist. It's not a complete end-all test, but it is a way that you can do this particular yoga pose and get insight into some sort of misalignment between your right and your left sides. Separate your feet so they're about hip width apart, and then bend your knees and bring your hands to the floor. Now, I have no problem straightening my legs and bringing my hands to the floor, but that's not what we're doing. So you have to keep your knees bent for this one. Hands are on the floor, and from here, I'm going to pull from my outer knee to my outer hip. So I'm going to pull one hip back, and then I'm going to pull the other hip back and get an assessment of which one is easier. So this is my left side, and I'm pulling my left hip back. I come back to neutral, and then I pull my other hip back. Now clearly this hip has a harder time pulling back, but I'll show you again. One hip pulls back, and then the other pulls back. Now since this one has a harder time pulling back, I'm going to stay with this one pulled back, and I'm going to try to pull it back more. So from here, pulling my right hip back. Now I stay here again, and I look to find motor control to activate the motor units to actually pull that hip backwards so it equals the distance that the left one went to. And you see that the longer that I stay, the more that the range of motion starts to come. Come back, and up. Again, it's not an end-all test, but it will give you some information about which hip is forward, which hip is back, and what the rotations are in each. Thanks.